our esteemed guest speaker, Laurie Benson. Thank you so much for being here, Laurie. Laurie and I met in, I think it was April, at the APHN conference. And as we were leaving, of course, we had some wonderful experiences there, speaking about public health and policy and empowering nurses. And we were so lucky to connect last minute as we were both leaving to head back home. So we shared an Uber ride together and got to know each other a little bit better. And that's how we've gotten her to speak for us. So Laurie Benson is the Executive Director for Nurses on Boards Coalition, and she's not always worked in what we would consider a traditional nursing role, but she's always led with her nursing lens in all the roles that she has taken. And she's here to talk about how being on a board of any board is really powerful to have a nurse on board with that lens to advance health and health policy and think about people and community first. So Laurie, I will open up the slides.
Very interested in the work that you're doing. And while I'm speaking to you today, certainly if I can ever help support the important work that you're doing, I'm happy to do so. So thank you for inviting me to the Nurse Policy Cafe. So as we get started, I wanted to take a moment and just think about the title. I met with Grace and Michael to learn what's most important and what you're working on. And so today we're talking about owning your influence as nurse policy entrepreneurs, shaping policy and strategy through board service. So as we get started, we've already welcomed everyone. Grace is so wonderful about making everyone feel at home. If you could go back one slide, I'm just going to share just a tad about, at our core, we're all people. And I believe people have good intentions and we all want to do our part to make a difference. So as Grace shared, I've spent part of my career in business where I had a technology systems integration company where I was privileged to serve as the CEO and co-founder. For 25 years, I had my own consulting business, and now I serve as the Nurses on Boards Coalition Executive Director. My favorite things in the world are my family and my friends. Nature, so you can see a few of my favorite nature photos. Adventures, I love to try new things, meet new people, and certainly the positive power of nursing leadership. My passion is leadership, and board service is leadership applied in a governance setting in a boardroom. Encouragement, we've already experienced that this morning. It's so important for each of us to have empathy and encourage each other and see the impact of that encouragement. We all respond in our own way to that, and making an impact to make life better for others. So then I just listed my board service, which is public company, financial service company, different private companies. And then of course, I'm serving on the University of Wisconsin School of Nursing Board, which is my alma mater, because I'll always keep my arm around the profession. So that's just a little bit about me. And I always say I'm proud to be a small town girl, humble personally, but bold about the things that matter most. So our learning outcomes are really to identify how nurse policy entrepreneurs like yourselves can address, influence, and shape policies to improve health. Consider some new ways. When we bump out our boundaries, that's where the magic happens. So give yourself permission to consider things maybe that you wouldn't have before. And then you can decide if it's right for you. But this is a safe place, as they say, to consider those opportunities. Identify and gain competencies that are essential for board service. And then I'm going to give you access to resources and information that you can access from time to time and discover your path. One of the exciting things in life is everyone has our own path, and just keep taking steps forward. So there's a place for every one of you if you truly want to serve on a board. And then set a goal. How are you going to just lean in, use your influence a little differently to make an impact? So now I'm just thrilled. I had never met Angelique. I'm thrilled you're here this morning. But I came across her blog. It is about, are we on board yet? And when I read it, it really reminded me that everyone starts their journey in your own place. And it might not even be on your list of things to do. So Angelique, if you would, I included the link to your blog. Would you like to make a few comments about it? I invite you to.
Mute now. Yeah, sure. Yeah, so when Grace asked me to write this blog post for this month, I hadn't actually had this board opportunity yet. It was probably a couple days later that this kind of came across my desk, so to say. So it became even more exciting to really dig into this. In preparation for this blog, I immediately ordered this book from Connie Curran, Nurse on Board, Planning Your Path to the Boardroom, and absolutely devoured it in like 2 days, highlighted everything. Very, very essential knowledge that I just had no idea was out there. So yeah, it's just the beginning of my journey with board service, but I think it's really great to be able to have this outlet for the blog too, so I can come back in like a year or so when I've been on the board for a minute and kind of ruminate about my feelings around it and the excitement. So I'm really looking forward to looking at more of the resources of Nurse on Board Coalition. I've done the readiness assessment and a couple other tools on there, but really diving into some more of the training and skill set aspects of it that I want to develop more. So.
Well, thank you so much for sharing your comments. In the book by Connie Curran, is also an alumni of the University of Wisconsin-Madison. So I was able to get to know her. I actually contributed a little bit to the book, which Angelique included in her blog, but she has passed away now, but she is a powerful voice for the importance of including the nursing perspective in the boardroom. And her legacy lives on through all of us who answer that call in our own ways. So thank you for making that real for us. So when I thought about the Nurse Entrepreneur Cafe, I thought, well, where do we align? So I did start with just looking at your mission and the mission of the Nurses on Boards. So our mission we say NOBC, Nurses on Boards Coalition, is to improve the health of communities through the service of nurses on boards and other governing bodies. And the NPE Café offers a safe and productive environment for nurses at all levels to develop into effective thought leaders and full partners with all other disciplines to reform and restructure healthcare policy. So we have a very natural intersection that leads us to having that impact. Definition of board service, I just wanted to say it's broad, we're inclusive. So if you serve on a board, whether it's advisory, if you serve on an advisory committee, if you're appointed, perhaps serving on a commission, all of that comes under this broad umbrella of board service, which we define as any corporate, government, nonprofit, advisory, or governance boards or appointments that have fiduciary and or strategic responsibilities. So when you're shaping policies, this absolutely falls under that definition. So as we think about the mission and work of the Nurses on Boards Coalition, we have 3 strategic imperatives that support our mission to improve health in communities through the service of nurses on boards. At a high level, you can see those in the rose shading. I'll just point out the 3 strategic imperatives. The first is NOBC targets board placements where nurses can influence policies regarding the social determinants of health to ensure social justice and equity at the community level. So policies are part of that strategy. Secondly, demonstrate the value of nurses in board seats. Identify perceived barriers and publish and disseminate measures of success related to desired outcomes. We noticed that in the literature, there is not much research that has been done that really addresses demonstrating the value of nurses on boards. So we conducted an inaugural survey last year in April, and we sent it to nurses who we know are serving on boards. And the survey addresses what social determinants of health is your board addressing and what impact are you having. So excited to share, we had 3,900 completed surveys, which is phenomenal. So we're analyzing all that data. And then the third strategic priority is to continue our core work to be a conduit for placements on boards. So what we're doing today, coming together to learn about the opportunities and how you prepare and pursue, that is a strategic imperative for us and very important. So thank you for joining us to do just that. I thought you'd appreciate, we have over just about 28,000 nurses registered in our database. A little bit later, I'm going to share the QR code so you can register if you have not already done so. And we have 11,200 boards where nurses are serving that are outside the profession. So the founders had a key strategy that 10,000 board seats would be filled by nurses outside the profession by 2020. And I know you can appreciate that. That was during COVID, so it took us to January of 2021. But we achieved that goal thanks to many of you who registered your board service. And I find it very interesting that 4,000 of the nurses who are serving on boards want to serve on additional boards. So when we talk about board service, it's interesting because once you get on one, each board is different, but there is an appetite then for when you see the impact to serve on other boards. And think about this, there's 15,000 nurses that want to serve. So we can't find a spot for all 15,000 on our own, but we can sure apply those strategies and create opportunities that we can cascade, but help nurses like yourselves prepare to pursue those opportunities on your own. So making it real. We've already heard from Angelique. I wondered if any of you are currently serving on a board. If you'd be willing to just share about how you got on your first board, how that came to be, and a little bit about your experience. So I would love it if someone is willing to share.
I serve on a few different boards I can talk about.
Great, thank you.
Well, the first one, I would say it counts as board service. The first one would be the VFW. When I was deployed probably almost 20 years ago, I got an email that, they were looking for members for the VFW. And I thought, oh, sure, why not? And so then when I came home, I decided to attend meetings. And the need is always ongoing for people to not only attend the meetings, but hold an officer position. So I ended up to be the junior and senior vice commander for 17 years. And now I'm the post surgeon, which is the medical officer. They call it a surgeon because the very first medical officer in 1918 was a surgeon. So they still call it the post surgeon, but it's just the medical officer. And so I can add health perspectives to a lot of the veteran issues. They've put me in charge of everything from talking to students about military service in the medical professions to organizing and distributing durable medical equipment that veterans donate to our post, to talking about health aspects of, well, a big one was they allowed smoking in that post for many years, which was really gross. Eventually, during COVID, we got a new commander who put an end to that, and the VFW eventually issued a statement that they weren't going to allow that in any of the posts anymore. But in the meantime, our commander died from the secondhand smoke. So as hard as everyone fought to keep the smoking in there, I don't think it was worth the life of our commander, and they know that now. And I hope to put up CDC guidelines regarding alcohol use, because we do have a bar in there. And that may not go over well, but I've been unpopular in the past, so that's okay. As far as other boards, I serve as the secretary for Connecticut's, the Connecticut Organization to Advance palliative care education, and they're the ones that are helping me with my DNP project to do more faith-based programs in churches regarding advanced directives and end-of-life care and resources, because Connecticut has very low utilization of hospice services and very disease-directed care that isn't appropriate for those in the last stage of illness. And that's devastating for families, quality of life, and also we spend billions of dollars a year on medically futile care for people that are dying. So we try to educate the public and other providers who don't get much education in their programs of study regarding end of life. So that's that role. And the other one, I took over as vice president of the local, our local Sigma chapter, because they didn't have anybody to fill that position. And I am the only one on the board that's not a professor. So they kind of like having a different perspective because I'm not a professor. Everybody else is a professor. So it was almost like a club for the professors, but so they have one outside person. And just help with they have a research day that we help with once a year. And we also speak to students and help with inducting students and getting them involved. Unfortunately, most of them just kind of sign up around the time of their graduation, but don't always keep going with it after they graduate, and don't get the message about events and meetings. So it ends up to just be the same professors that are logging in all the time, but we hope to work on some of that. So
Well,
that's it.
Leah, thank you so much. I want to, first of all, thank you for serving our country. And
Oh,
absolutely. And I'm a VFW member, and I appreciate the changes that you've brought about. You are a shining example of what are the things you care deeply about. And that's a great place to discover a board where you can impact the policies around those issues that you care about so deeply. So, and then also when you're saying you might be the only voice, with the nursing perspective, so, or in a different role. And that's such an opportunity to educate, as you said, and then others will be more willing to consider important changes. So thank you for sharing your 1, 2, 3. You certainly prove the point that once you serve on a board, probably others will follow as well. So thank you so much. Does anyone else want to share their board journey, how you got a board role? Yes, Angelique, please.
Right. Yeah, so I alluded to this in my blog post, but and I wanted to mention this. I think Joanne might not be on the call any longer, but it kind of ties back to my time at university. And basically, my journey to this particular board began over a year ago when I was at University of Edinburgh, and my professor for my nursing and global health policy course was Aisha Holloway. She's fantastic professor and nurse leader, and we had a whole week on strategic networking, and she gave us a piece of paper and said, okay, write down your entire network. At that point, it was people from UCLA, from my undergraduate alma mater, and from Timmy Global Health. And I was like, okay, I mean, I know some people, but I could definitely expand this. And that's the night I opened my LinkedIn account and just typed Timmy Global Health into the search bar and added everyone I knew from there, and a couple people I didn't, including the executive director who I'm working with now, just kind of on a whim. And I've never met the executive director, but or really interact with her on LinkedIn since then, until she made that post saying they're looking for boards of directors members. And it felt very serendipitous, because I don't think I would have had access or knowledge to that posting if I hadn't done that over a year ago. And just made that connection. And yeah, I just commented on that post because they were doing an in-person event in my hometown, Indianapolis, where they're based and where they're trying to recruit members. I said I couldn't make it to the event, but I'm still very interested in learning about board service. And we messaged back and forth. She asked me about my experience with the organization, which I said is branched back 10 years ago. I first started volunteering with them as a nursing student at Ball State University in 2013. And I've been to Ecuador and Guatemala 5 times with them since. So I feel like I'm uniquely positioned to serve on this board as a nursing student who is particularly, active within their college programming, I guess, but and who's been on these medical service trips and seen these issues firsthand. But then also as a nurse who has had more clinical experience since then and grown in my own capacity and leadership to serve on this board. And as far as I know, I don't think there have been any other nurses on that board. There's a doctor and professors, I believe an accountant, a couple other seasoned professionals, but I'm really excited to bring my very, I think, suited voice to this conversation. But I know that Joanne is great friends with my professor, Aisha. So it's funny to see, it was great to see her on this call because I'm like, man, it's still coming full circle. Like Grace said, the world is just a small place for nurses, which is great. So I'm loving all these connections happening.
It's a big place to make an impact, right?
Right.
So,
right.
And I noticed, I'm sure everyone else did, you were just smiling as you're sharing this, it's taking an initiative. It says, how will you lean in? Well, you have certainly leaned in and look what happens. And that's just really exciting because organizations may not know about you. And so finding that way to connect is just so powerful. Well, now I think that if there's others who want to share, we'll allow that in our comments and questions. But I'm going to cover 3 areas. One is why nurses, why now? Then how you choose the types of board opportunities, how you choose which one, impact, and then we'll just close with any more questions or comments. So thank you for your active engagement. It inspires me too. So why nurses, why now? Angelique just used these words that nurse policy entrepreneurs and innovators are uniquely and ideally positioned to lead change. I know you understand this, but the key point here would be that the skills and competencies you develop in clinical, academic, and community roles translate very naturally into effective board service. So especially being change agents, systems thinking, and evidence-based. So then we talk about board service, really what it is. It's just simply bringing all skills, experience, expertise that will help the organization's impact and advance its mission. So that always brings me back to why board service in the first place. There's 4 obligations of board members: duty of oversight, care, loyalty, and obedience. So you can spend a little time on these on your own, but this applies to any board. And basically, we want to make sure we're doing our due diligence, that we're prepared for meetings, that we are looking at the risks of the organization and being stewards of that so that we're in compliance at the same time for aspirational reasons to elevate the mission, work, and impact of the organizations. And sometimes people say, oh, I'm concerned I have a conflict. Well, that duty of loyalty, you just close your conflicts. And then if a topic comes up that you have a conflict, then you just don't participate in that vote. So I thought that it would be helpful to have those obligations. So now we're going to talk about the responsibilities of each board member. And I'm just going to pick out a couple of these, but you can refer back to them. One of the most important things is prepare for board meetings. You want to come with that you've done your homework as a foundation for the deliberations and discussions that happen in the boardroom. Nurses are great at being prepared, but not all board members necessarily are. And so you want to be a role model of that preparedness and accountability. Then we try not to have, don't make special requests of staff because most of these organizations have small staff. And so bring up your ideas strategically and then let them figure out how to implement. Keep it high level. And if there are committees or task forces to serve on special assignments, This is where you can influence and shape a lot of those policies and strategies we're talking about. And just remind yourself that listening to others in the boardroom can shift your views on things, and modeling our excellent communication skills that are inherent to roles in nursing. So when you think about how to find the right spot for you, me, we've already heard 2 wonderful examples today about it, but start with an open mind and your why. You know, why, if you're going to spend your time, it needs to be important. Then think about, well, how am I going to contribute there? It's so important. I know that there's so many accomplishments you want to put in a CV, but you need a 1-page bio. People's attention spans, you need to stand out. So look at your CV, say, what are the themes, and come up with a 1-page bio so you will stand out and be considered. And of course, register in our database and never ever underestimate your value. When we talk about your passion, I don't have to explain that any further than the stories we've heard today in the introductions. But here's some examples, from food insecurity to mentoring emerging leaders, maybe building inclusive environments, and for you, informing policymakers. So let's look at the questions. Once you figure out what you're passionate about, there's got to be a board associated with it. If you don't find one, just send me an email. I'm happy to help you. These are questions to ask yourself. Do I really care deeply about that mission of the organization? Can I put is the leadership, the culture in alignment with my values? And do I like the tone? And your name's going to be on this. So these are questions to ask before you join a board. And then the next slide talks about questions to ask the board leadership. So make sure you know what's expected. Whenever I'm asked to serve on a board, I always say, okay, help me understand. What are you seeing how are you seeing that I can contribute? And so I know right up front where they're expecting me to make a difference. And then asking questions. Is fundraising involved? At what level? All of those kinds of things. How are they doing financially? It's okay to join a board if an organization is struggling, but you don't want it to be a surprise. So you can use those as a reference. Now let's talk about opportunities to serve. I'm going to share just a few brief examples. We already talked about AARP this morning. So AARP is a founding member of the coalition. And if you have not heard of AARP age-friendly communities, please check it out. There's over 800 in our country. Some states are age-friendly. And what this means, it's not a designation, it's a commitment to address the 8 domains of livability, which include housing, transportation, access to care, and green space, etc., which we know as the social determinants of health. Just wonderful opportunities to serve, and nurses contribute, and they welcome nurses to serve alongside them. And it isn't for seniors only, it's from childhood through end of life. United Way, we got the first 2 nurses on their national board. They'd love to have nurses on all of their boards and their committees. And allocations committees are really important because that determines where the funding goes in your communities, and you can be a voice for those populations that would benefit from the services. I see someone enthusiastically said, you're an AARP member. That's fantastic. There's 200,000 nurses that are AARP members. The Alzheimer's Association is one of our strategic partners, and they have a program in place to get nurses on all of their state boards. So that's a wonderful opportunity. And then CASA, court-appointed special advocates for children aging out of foster care. So there we started the state level in Ohio, and we got nurses on most of their CASA boards, and now we're sharing that nationally. So these are examples. They can start nationally, they can start locally, but we can cascade them and leverage that, and not only in our country, but around the world. So I hope that's good for thought starters, and that you're thinking about where I might serve in a new way. So making an impact, I just want to share we have received 2 significant grants. The first is supporting underrepresented nurses for successful board service. What we did was focus groups. We held focus groups, surveys with 8 participating nursing organizations, including NCMNA, which is the National Coalition of Ethnic and Minority Nurses Association, Chi Phi, Men in Nursing. And we've all worked together to identify where there's gaps that are barriers to successful board service for underrepresented. As a result, they created their own curriculum. And this is all thanks to the American Nurses Foundation. I'm going to share those, the curriculum that they created in just a moment. The other grant we received is from our colleagues at the AARP, Strengthening Nurses' Voices to Improve Health Equity, a Community-Based Approach. And this is where we're working with action coalitions across the country to also identify barriers to board service in addressing the social determinants of health. This study funded that inaugural survey that we talked about to measure the impact of nurses on boards, as well as provide educational programming for nurses across the country. So now resources. The first opportunity is certainly going to our website. And if you're going to be a new trustee, we have 3 models: board competencies, readiness, and support roles for success. We interviewed all kinds of nurses to find out what are the skills that are essential for board service. What do you wish you knew when you served on your first board? All of this has been brought together in the board readiness, competencies, and support role success model. And the competencies are organized around 3 domains: self-leadership, organizational leadership, and then civic and professional leadership. So hopefully you'll be able to use these models to inform your journey. What you can do right now, I always love that call to action, right? We all have a sense of urgency, I know from our introductory conversations. So you can register in our database. The QR code is there. I promised you we'd share that. And then you can be considered when we will search that database when your interests match the qualifications of board opportunities we create. Receive our newsletter. It's once a month. We celebrate nurses who are appointed to board service. There's always stories from exemplars who are serving on boards and new resources. So we never use this for marketing, and it will be once a month. Here's the link to all of our resources. And then what you can do right now, volunteer for your own cafe leadership roles, run for office. Think about in your own organizations, where can you shape those policies? So I love the power of boldness, saying, I can do this. I can make a difference. And I hope that that boldness comes from your fervent desire to make an impact by shaping these policies. So whether you call that leaning in or jumping up or standing tall, please be bold. And then support and encourage each other to serve on a board that matters to you. So if you're already a trustee, like several of you, help us create more board seats and build that leadership in new nurses. And then get involved by championing these broader policies with colleagues and sponsor emerging leaders. Because I'm sure many of us have had opportunities because someone saw something in us when we least expected it, and they felt we could make a difference. So we want to make sure all nurses have these opportunities. So at this point, we have covered, why nurses, why now? We've talked about our alignment with the Nurse Entrepreneur Café participants, and we've experienced that. Why do we make good board members? Where might we serve? And absolutely aligning that with your passion. So we've got resources. We have support through the Nurses on Boards Coalition. Sigma came up several times today. They're a founding organization. We're all in this together when it comes to applying and including the nursing perspective in leadership roles that include governance and shaping policies and strategies to improve health for all. So I'm here as a resource. We're going to go to open questioning and sharing. I do want to, on behalf of our board of directors, that was our recent meeting at the MedSurg Nurses Association in DC on June 13th. And my email is here. And I want to thank each and every one of you for your thought leadership and your personal commitment. even on a Saturday, to realize NPE's Cafe's vision to reform and improve the quality of healthcare policies locally, statewide, nationally, and globally. So I want to thank Grace for being the facilitator here, for advancing the slides, for bringing us all together. We can close the presentation now and just I'll be happy to answer any questions and any comments that you have. And I sure hope this was helpful for all of you. Thank you for your wonderful attention, engagement, and for all you do.
Thank you so much, Laurie, for such a wonderful presentation. You always give such a good presentation, and I love how you really take the time to focus on the individual comments and kind of like tying it all together. That's really special for me to hear and feel and see. I also want to thank Michael Polachek, who's not on the call today. He's in transit, but he was the one who has done the research on what a nurse policy entrepreneur is and the way that we can host this space based on the World Café method. So I just want to acknowledge him as kind of the spearhead of this evolving project, collaborative evolving project, I'll say.
Thank you. And when you have the opportunity to hear his story, I had not met Michael, but Grace and Michael and I had a call because I wanted to learn everything I could about you to make our session today relevant. And I was so inspired when he shared his journey to the boardroom. And it's a story of humility and boldness simultaneously, right? I mean, he just thought, okay, I'm gonna do this. And we can all learn. And I know that he has hosted a session about board service too. And he's certainly a champion, right? He is absolutely a champion.
Yeah, definitely a champion for talking about how to, when you find your passion, you find your why, you align that with the organizations and the core of their work, their why. And then once you kind of gain those skills and you find your way, how do you share that with somebody else? How do you support your fellow nurses? How do you support the next generation? And that's why we're all here today on this call. So thank you for tying that all together.